Heart disease is very common, and it's the leading cause of death in both men and women. About 620,000 people have cardiovascular disease, and of that, about 370,000 actually have coronary artery disease. About every 43 seconds, someone has a heart attack, and that adds up to about 733,000 heart attacks a year. So it is a very big problem that we have to approach in our medical practices. The risk factors for cardiovascular disease include hypertension, which is high blood pressure, high cholesterol, and smoking. Those are the big top three. Also, obesity and diabetes and family history also contribute. The number one cause, though, with hypertension is very common, and about 67 million people in the United States have high blood pressure. Prevention for cardiovascular disease is very important. In primary prevention, we try to control the blood pressure, cholesterol, blood sugar in order to prevent cardiovascular disease from occurring. But the best form of prevention is primordial prevention. Most people aren't aware of this form of prevention. In primordial prevention, we try to prevent them from acquiring the risk factors for cardiovascular disease. Studies have been done that have showed that children and adolescents that participate in certain behaviors increase their risk for developing these risk factors and therefore developing cardiovascular disease as an adult. Those activities include poor nutrition, sedentary lifestyle, decreased exercise, and smoking. And if we can prevent children from participating in those types of behaviors, we can decrease their risk of cardiovascular disease as an adult. Approximately 17% of our children in the United States are obese, and that adds up to 12.5 million children. If we can decrease the rate of obesity in children, we will decrease the rate of cardiovascular disease as an adult.